Welcome back to Morning Joe. It is just about the top of the hour on this Thursday, May 14th. Let's dive right in. Joining us now, former FDA Commissioner Dr. Scott Gottlieb.
Hey, Doctor, thank you so much for being with us. Let's start by talking about the tests that are being used at the White House right now. And those are the Abbott tests. Obviously, a lot of people excited about the fact that they rolled out one of the first tests that could provide quick results. Now we're finding out that not as accurate. You tweeted about this yesterday, not as accurate as it once was hoped. But can you just talk about this process? And it's a messy process where FDA guidelines, because it's a pandemic, maybe they've been lowered and things have been sped up as far as regulation goes, much more than usual. And the sort of trade-offs that we're going to be making like this.
I don't think it's so much a regulatory trade-off as it is a trade-off between different kinds of testing technology. The machine that's being used at the White House, the Abbott ID machine, or the antigen-based test that was cleared over the weekend by Quidel, or Becton Dickinson has a similar machine that's now installed in doctors' offices. These are tests that are typically used to test for things like strep throat or flu. The virtue of these tests is that they're cheap and they're easy to use in a doctor's office. They're highly specific, meaning that if they say you have the strep throat or flu or coronavirus in this case, then you do. But they're not that sensitive, meaning that a certain number of people who have these tests done who actually have the infection, the test is going to say that they don't have the infection. Now, used in the hands of a doctor, in a doctor's office, by a provider, where a physician might have an index of suspicion that the patient has the condition, the doctor knows that if they get a negative test, they might send off a confirmatory test anyway, just to be sure. But these aren't good tests used for screening asymptomatic populations where your index of suspicion is low, and if in fact you get back a negative result, you're going to count on that and you're going to say that person's all clear. For that kind of a situation, you want a much more sensitive test that's unlikely to miss anyone.
So we have an NBC colleague who tested negative 4 times, ended up with the coronavirus anyway. Obviously, an outbreak in the White House. A few people have gotten it in the White House despite being tested every day. Is there a specific test that you think should be used in the White House?
Well, it's a tough call because the White House wants to test with what we call high throughput. They want to test that they can turn over quickly. They want to get a quick result because of people bringing people in and out of the White House, and that's why they like the Abbott machine. The other machine that has higher sensitivity but also is a pretty quick machine, it can give a rapid result, is the Cepheid GeneXpert. That takes about 45 minutes as opposed to the Abbott machine, which takes between 5 and 15 minutes. So the Cepheid GeneXpert takes a little bit longer to give a result, but the sensitivity is much higher. So that's a better machine if you want to use a point-of-care machine, and you really don't have any margin for making a mistake in terms of having a result that says you don't have coronavirus when in fact you do. So that might be a better machine for that kind of a purpose. But the point is that, you know, we need to make sure that the technology that we're using is fit for purpose. There's different tools that could be used for different purposes. So, for example, if you're a business and when you want to do widespread screening in the workplace, that's a situation where you might use high-throughput PCR or you might use next-generation sequencing where you can do what we call pooled samples. You can basically have 50 people spit in a tube at the same time, and instead of testing each individual person, you test the pooled samples, and then if you get a hit, if you find someone does have the virus, then you go back and test people individually. So there's different technologies that are suited to different purposes, and you just need to make sure you're using the right tool for the right purpose.
You testified yesterday in front of Jim Clyburn's committee on the coronavirus crisis. The hearing was focused on reopening the economy while we still have the coronavirus. So how are we doing right now? What are the recommendations that you gave Jim and the rest of the committee? And what do you suggest we do moving into the summer, making summer plans, and even as my family did yesterday, not only make summer plans, but starting to make plans for the fall in school? What are we looking at?
Yeah, it's really hard to tell what the fall is going to look like. It's hard enough to tell what the next month's going to look like. Right now, if you look at what's happening nationally, even when you back out the statistics from New York, you see a declining epidemic nationally. So over the last 2 weeks, we actually have started to see a decline in new cases and in hospitalizations, even against the backdrop of more testing. So that's the good news. we're also seeing an epidemic that in certain states is expanding. So if you look at states like Minnesota, Nebraska, Missouri, Alabama, Arizona, Wisconsin to some degree, Kansas, Kentucky, Tennessee, Texas, you're seeing cases go up in those states. And so nationally, the trend is in a positive direction, but there are still states that are pretty hot, and we're still seeing localized outbreaks. So that's likely to be the case. This is not going to be a uniform epidemic. Even as the national trends improve, we're still going to see hotspots, and there's still a risk that a state can have an outbreak, and that outbreak can then lead to a more regional spread. I think as we go into the summer, I'm hopeful that there's going to be a seasonal effect here. So as we get into the summer months of July and August, the virus will start to dissipate. Probably won't go away, especially since we're opening against a backdrop of a lot of spread. But I'm hopeful that there is a seasonal effect here. But once we come back in September, that's going to be a new risk. And especially as this starts to collide with flu season, it's just too early to tell what this is going to look like. I think that there's going to be an attempt to open schools in the fall. Probably this is going to be something that's made on a basis of local decisions, state by state, locality by locality, depending on what the background spread is in a community. And that's probably the right way to make these decisions.
But you know, we're hearing reports, I think it's out of South Korea, where there was spread in workers' dorms. Is there a possibility that maybe the officials split the babies and they allow people to go back to school, but maybe are far more suspect of sending a bunch of college students or even high school students into dorms?
You know, the colleges right now are starting to contemplate what they're going to do about residential college campuses, and I've had some discussions. They're looking at things like testing everyone before they come back onto college campuses. That's only going to provide so much protection because the virus, as we know, spreads, and just testing everyone as they enter doesn't mean that you're not going to have an outbreak after the fact. I think the South Korea circumstance and what happened in Singapore also reinforces that, you know, it's vulnerable communities and at-risk communities that face the highest risk from this virus. And it's important to get testing into those settings. So people who are working on production lines, people who work in grocery stores, they're at higher risk of contracting the infection. And we need to make sure we have testing at those work sites. That's been a challenge to make sure that we're getting the resources where they're needed the most.
Dr. Gottlieb, want to ask you more about reopening colleges. My first question, though, is somewhat related. Can you explain why it is important to wear a mask, and more specifically, how important is that measure compared to other measures in the list of guidelines being put out by the government, the White House?
Well, the mask is really to protect people from you. So the cloth mask that we talk about, it might provide some partial protection to you as an individual, but what it's really doing is it's cutting down on the risk that someone who has the infection might be asymptomatic or mildly symptomatic and not know that they have coronavirus, the risk that they will spread it to other people. So it cuts down on their respiratory droplets and their ability to transmit the infection. If you have a better quality mask, you're wearing, you know, a level 3 procedure mask or an N95 mask, if you have them, that's going to afford more protection to you as the individual. But right now, there's been a shortage of that personal protective equipment, so we haven't been able to get those masks out to people. That hopefully can change in the future, that we're going to have more of this equipment and we can make it available to consumers. But the main benefit of the mask is to cut down on the risk of transmission from the individual who might be infected to others. And it's an important measure. If we can get people to wear masks on a widespread basis, it can cut down on transmission. We had one study from NIOSH that demonstrated a 50% reduction in the transmission of flu in a community that wore masks. We don't know that that's going to be transferable to coronavirus, but that's a pretty big risk reduction just from a simple intervention like wearing a mask.
Absolutely. So then what does that look like in U.S. colleges? You had said that you think that U.S. colleges might be able to welcome students back in the fall. I've got a girl going to UVA in the fall, so I'm personally, I mean, are these kids going to be asked to wear masks? How is it going to be possible that college kids are going to not mix and spread the coronavirus?
Yeah, and, you know, this is always, you think of like barracks, people coming back in the military and college dorms, because you have a lot of people coming from a lot of different communities, mixing, living in close quarters, coming from communities where there might be more spread. So these are high-risk situations. I think really the decisions around this are probably going to be made in July and August and are going to depend on what the spread is in the country at that time. You know, again, I happen to believe that as we get into July and August, there will be a seasonal effect here, so you're going to start to see spread dissipate a little bit, hopefully. early. Hopefully we don't reopen and reignite another large outbreak or epidemic. We get into July and August, there is a seasonal effect. So there might be an attempt to reopen college campuses and schools. But if there's outbreaks and there's widespread transmission of the virus in the fall, you could quickly see those decisions reversed and schools closed again. But I think that there will be an attempt made to try to do that. Colleges might make decisions to try to do more distance learning, try to bring back fewer students. They might make decisions in terms of how they keep students in the dormitories. You've seen some of those proposals come out right now to try to separate students more. Public schools might make decisions to only have classes 2 or 3 days a week and stagger it more so you're not bringing the whole class back at one time. So you might see communities make decisions to try to create some social distancing within the context of reopening schools. But I do think that generally, as long as we don't have widespread transmission heading into September, there's going to be an attempt made to try to reopen the schools in the fall.
Willie.
Dr. Gottlieb, it's Willie Geist. You and other doctors, respected people on public health matters, have said it's all but certain that coronavirus will return in the fall. So with that in mind, I know a lot of school districts are talking about moving up the school year to try to sneak in as much as they can before it does return, maybe start in late July, even or early August, if your school was supposed to start in September, to move up the school year. Do you still believe that this coronavirus will be back in our lives in the form it is right now? In other words, shutting us down in the fall? And if so, what should superintendents and school boards be thinking about as they plan to go back?
Well, this isn't going away. This is probably going to become endemic. Hopefully we'll get a vaccine, but this is something we're going to have to contend with for a while. But if we have good testing in place going into the fall, where we're able to detect outbreaks while they're still small, we have good track and trace, so we're tracing down people who are sick with the infection, trying to isolate them, tracing down their contacts, and we're able to prevent small outbreaks from turning into large outbreaks, then this can become a localized endeavor where, you might have to shut down a community. You might even have to take mitigation steps within a state, but you don't have the national epidemic that we had this time around. That's the hope. That's going to be dependent upon us getting really good screening into the community so that if there are 30 or 40 cases in a community, you can detect it at that level before it becomes 1,000 cases and you're at the point where you have an epidemic that's so widespread that the only thing you can do is really shut down the community. But, hopefully we're going to go into the fall and really be able to detect where this is spreading. I think you're going to see local school districts close. You're going to see outbreaks within states and local communities, and you're going to see a rolling mitigation effort. Hopefully it doesn't become a national epidemic. The risk is, though, that when this starts to collide with flu season and you have the confounding effect of flu against the backdrop of coronavirus spread, that becomes a real challenge. And so one thing we should be trying to do is get more flu vaccine into the system, which we've done. The manufacturers have made more vaccine in anticipation of higher demand this season, but get people vaccinated early, because the more we can reduce flu incidence, the more we can identify coronavirus perhaps more earlier than we might have otherwise.
And as you say, so much dependent on testing. I want to ask you, Dr. Gottlieb, about the states of Georgia and Florida. There's been a lot of focus on those two places. Did they reopen too soon? The governors there slowly reopening the economy to some retail business. And if you look at it the last couple of weeks, and specifically in the last week, they have not had an explosion of cases. That, in fact, the cases have gone down over the last week. What should we be reading into the cases of Georgia and Florida as other states try to decide when it's safe to go back into the water?
Well, one thing that those states did well was they got their testing up. So when you look at the data from Georgia, the positivity rate, the number of people who are positive, has come down as the testing has gone up. And that's a really good measure that they took. Florida did the same thing. They were able to grow their testing fairly quickly. And the data does look good over the last week. I've just looked at this morning before I came on the air, and you're seeing hospitalizations not tick up. You're seeing the number of cases actually come down and the positivity rate come down even as testing increases. And so that's a hopeful sign. Now, that said, what we really need to be watching is hospitalizations and deaths, because they're more objective measures of whether or not you're having an expanding epidemic. And there's a lagging effect on those two indicators. So the time to hospitalization is about 8 days. And so really, when you're looking at hospitalizations today, it's really telling you what happened 8 days ago. And time to death is about 18 days. So people who succumb to this infection typically do 10 days after they're admitted to the hospital on average. And so those are lagging indicators. So I think we need a couple of weeks of data to really know what direction this is going in. But so far, the initial data out of both Georgia and Florida do look encouraging, that they've been able to restart economic activity without a big upsurge in cases. And it may be an indication, and this is speculative, that there is a seasonal effect here as well, that the warmer weather in the Sun Belt in the south where it's getting hotter and more humid more quickly, maybe that is having some impact on spread, and more of the activity is able to be pulled outside in those states. And we know that activities held outside are lower risk than activities held inside. And so localities should be trying to move things like religious services, gym classes, even restaurants, trying to move those things outside wherever we can.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.